Hi, this is Dr. Daljeet Kaur. I'm the consultant psychiatrist in Hyderabad. I'm also the founder of Dawn Healthy Minds, which is a training and wellness network for mental health. Today, I'm making this quick, brief video on depression. The reason being, we've heard so many celebrities, losing their lives. Mr. Sushant Singh committing suicide yesterday, and that there's been so much talk in the media about depression. So I thought, as a society, we need to understand what are the symptoms we need to watch out for depression. Let me make it quite simple for you. So I'll give you 8 symptoms that you need to watch out. So the symptoms I'm going to talk about need to be there persistent for 2 weeks. And if they are affecting your day-to-day life, then you need to start worrying and seek professional help. The first one to start with is mood. People's mood can go low, or they can feel agitated and irritable. There can be some mood swings too. So it's not necessary that a person is just sitting in one corner and crying. They could be just presenting as being really irritable and arguing. Then the second one is sleep. Either people sleep a lot or they could sleep very less. So they could face with insomnia, or they're just in the bed and wouldn't want to wake up. Third is the appetite. Appetite could be disturbed. Some people eat really less, they just lose their appetite, and others might go on, comfort eating, binge eating. Consequently, you would either increase your weight or lose your weight. Fourth is the energy levels. People complain of feeling really tired. They are okay, they have no physical health issues, but they just feel so lethargic and not wanting to go out of the house, not wanting to walk, just feel tired all the time. Fifth one being motivation. Your motivation can go really low. So, if you have to get up and go to work, you might not be able to do that. If you have to do your household chores, look after children, look after family, or look after yourself, even just getting up and having a shower or so seems hard work. For some of them, it can go into self-neglect, as in people might not even, brush their teeth or have a shower. The sixth symptom being anhedonia and loss of interest. What does that mean? Basically, things that you enjoyed doing in the past now don't seem to interest you. So hobbies or even regular things, watching TV, reading books don't interest you. And this is something, you used to enjoy in the past. Seventh is feelings of guilt, hopelessness, and worthlessness. So for no reason, you might actually start feeling guilty, and you might, hold yourself responsible for, so your thinking generally becomes negative. You might feel hopeless about future. You just feel that life's not worth living, there's nothing left for me. The self-worth goes down, self-confidence can go down. The 8th symptom is suicidal thoughts. Now, thoughts can either be fleeting, that means you're kind of okay, but you just have some suicidal thoughts on and off with no intent, or they can be continuous and it's always there on your mind. Should I do something to end my life because I can't cope? So overall, I repeat all these 8 symptoms. If they've been persistent, that means if they've been for most of the days, for at least 2 weeks, then you need to think that, something's wrong. I need to go to professional. Your professional could be your own family doctor. It could be a psychologist. It could be a psychiatrist. So please do not delay. If you find these symptoms in yourself, go seek professional help. If you see these kind of symptoms in your neighbors, family, friends, please take them to a doctor, because sometimes, as I mentioned, the lack of motivation is so bad that they might not want to go out and seek help. So friends, depression is treatable. It is fully treatable, and let's not miss out any of our loved ones for depression. Suicide is preventable. We all need to come together and support our loved ones, and then we can just make life easy for them. Thank you.